Hello, doctors. I'm Dr. Chris Rapoff of QME Continuing Education, and welcome to this week's presentation. Today, I'd like to discuss a condition commonly associated with adolescents undergoing rapid growth and physical development, which I'm sure you know is Osgood-Schlatter disease. Now, this condition is of particular importance to QMEs, as this condition can persist into adulthood in rare cases, leading to chronic knee pain and functional limitations that we may actually see in an examinee with knee pain symptoms. Today, I will provide some clinical insights and characteristics that are necessary to fully understand Osgood-Schlatter disease in adults if it were to present in a QME evaluation. So let's get started. First, these are the following sources that I referenced when producing the presentation of Osgood-Schlatter disease in adults. I encourage you to explore these references if you'd like a more in-depth understanding of our discussion today. The name Osgood-Schlatter disease comes from two surgeons who independently described the condition in 1903, Robert Bailey Osgood, an American orthopedic surgeon, and Carl B. Schlatter, a Swiss surgeon. Their research focused on knee pain in adolescents, particularly related to inflammation at the tibial tuberosity due to repetitive stress. Now, over time, their findings became widely recognized, and the condition was named in their honor. So, to repeat here, Osgood-Schlatter disease is a condition primarily affecting adolescents due to the repetitive stress on the patellar tendon's attachment to the tibial tuberosity. While it is commonly associated with growing individuals, some cases can persist into adulthood, leading to chronic knee pain and discomfort. Now, as an overview, Osgood-Schlatter disease occurs when stress and strain on the patellar tendon leads to inflammation and irritation of the tibial tuberosity. In adolescents, this condition arises due to the rapid growth of the bones and the repeated pulling of the patellar tendon. It's associated with growth spurts, peaking in boys at about age 12 to 15 years and girls at about 10 to 12 years. It's more common in boys than in girls. Up to 30% of the children present also with bilateral symptoms. However, in adults, unresolved bone fragments, as you see to the right in the X-ray, from the adolescents may persist, resulting in ongoing pain and mobility challenges. Now, this condition is particularly noticeable among individuals engaged in physically demanding activities that require frequent knee flexion and extension. So the causes in adults, the primary persistent Osgood-Schlatter disease in adulthood is the incomplete fusion of the tibial ossification center during adolescence. Some individuals experience chronic discomfort due to the presence of small bone fragments or calcifications that never fully integrated into the tibia. The repetitive stress from activities such as running, jumping, and even kneeling can further aggravate the condition, leading to pain and inflammation. Additionally, adults with previous knee trauma may experience exacerbated symptoms as weakened knee mechanics contribute to the ongoing irritation in the affected area. Some symptoms include, actually the hallmark symptom of Osgood-Schlatter disease in adults is localized pain at the tibial tuberosity, particularly when engaging in activities that involve knee flexion and quadriceps contraction. A visible or a palpable bony prominence may also develop below the kneecap, and it's accompanied by tenderness and swelling. Individuals often report discomfort when kneeling, climbing stairs, or engaging in high-impact sports. And in some cases, the pain can become chronic, affecting mobility and activities if left untreated. Diagnosing adult Osgood-Schlatter disease requires a thorough clinical assessment and imaging studies. Physicians typically examine the affected knee for swelling, tenderness, and bony protrusion. Radiographic imaging, such as X-ray, is commonly used to detect the presence of the ossified bone fragments and assess the tibial tuberosity changes. Now, in more complex cases, MRIs may be recommended to evaluate for soft tissue involvement and potential knee instability. So a comprehensive diagnosis is really essential to determine the appropriate treatment and the approach to prevent further complications for the individual. Some treatment options for Osgood-Schlatter disease in adults ranges from conservative care to surgical intervention depending on the severity of the symptoms. Now, the conservative treatments involve the Price protocol: protection, rest, ice, compression, and elevation to reduce pain and inflammation. Physical therapy is highly beneficial, focusing on the quadriceps and hamstring strengthening exercises to stabilize the knee and reduce the stress on the tibial tuberosity. Supportive measures such as knee braces or padding can alleviate discomfort during the physical activities. Now, if conservative methods fail, surgical removal of the ossified fragments may be necessary to restore the mobility and prevent chronic pain. The post-surgical rehabilitation does play a crucial role in ensuring optimal recovery. Prognosis: with the appropriate treatment in rehabilitation, many individuals experience significant improvement in knee pain and mobility. However, if left unaddressed, persistent Osgood-Schlatter disease can lead to chronic discomfort, limiting physical activity and daily movement. Early diagnosis and the tailored intervention strategies are vital for managing symptoms effectively and ensuring long-term knee health. Now, adults dealing with this residual effects of Osgood-Schlatter disease should prioritize their strengthening exercises and activity modifications to maintain optimal knee function. So, in conclusion, today we discussed Osgood-Schlatter disease, while commonly associated with adolescents, can significantly impact adults if left unmanaged. Understanding its causes, symptoms, and treatment options is crucial for maintaining long-term knee health and mobility. Now, by seeking early diagnosis and adopting tailored interventions and prioritizing strength-building exercises, individuals can reduce discomfort and regain their function. Whether through conservative management or surgical intervention, proper care can prevent chronic pain and enhance the quality of life. Staying proactive and informed is the key to successfully managing Osgood-Schlatter disease and preventing future complications. Well, doctors, I'm Dr. Chris Rapoff, and I wanted to thank you again for taking the time to join me in today's presentation. I hope you enjoyed it, and I look forward to sharing other interesting topics as they relate to the workers' compensation system in the state of California. Until next time, thank you.